Hello there, this is Dr. Aditi, and today we're talking about the anatomy of the skull. We're going to go over a myriad of features of the skull, from structures, foraminas, passages, prominences, all that. Now, the best way to learn this information is actually a hands-on approach, right? So if you have a model of a skull, because of course we all have models of skulls just laying around our house, use that. Well, to be fair, when I first started learning, I did purchase a whole box of anatomy bones because I'm a hands-on learner, so that really helped me. But you don't obviously have to have one. You can also just print out a picture of the skull in different purviews and follow along that way, and then you're tracing and writing as we go. That's another kinesthetic approach. The other thing you can do if you have don't have access to either of those at this moment, use your own body, right? You've got a skull. Imagine that. Handy enough. It's right on you. So you can just use your own body to do that too. Now, the other thing I'm going to give you in this episode is mnemonics to remember the skull, because there are 22 bones that you have to remember. So mnemonics do sort of help things out there. And then lastly, of course, we will do a mind map to sort of summarize everything and bring it all together. So let's get cracking. Now let's take a peek at the orbit, looking at all the structures that are present in the orbit, right? So the first thing I want to orient you to is, of course, this. And I think by now you know that's going to be your optical canal. Then you've got the frontal bone right here, right? That goes up there. Then up here you're going to have the sphenoid bone that's going to start, and that's the lesser wing of the sphenoid bone. And then there's that fissure, right there. That's the superior orbital fissure. And then you've got this greater wing of the sphenoid bone. And then on the side here, that's your zygomatic bone. And then this down here is your inferior orbital fissure, right? And then down here, this is your part of your maxilla. Now, there is this little triangle. Do you see that? That's your palatine bone. You just see a little smidgen of it. And then on top of that is your ethmoid bone. Again, this is still frontal, ethmoid bone. And then, of course, we've got the lacrimal bone here. Right? And there you have it. Here's another mnemonic for you to remember all the bones in the orbit area. It's some zebras might like eating food pellets. So some is going to be for your sphenoid bone. Zebras is going to be for your zygomatic. Might, I'm sure you guessed it, is maxilla. Like is lacrimal. Eat is ethmoid. Food is frontal. And pellets is for palatine bone, which is really hard to see. It's basically just a smidgen. But there you have it. That is a mnemonic to remember the orbit bones. Moseying on to the structures of the fossae, right? We've talked about the fossae. Well, what structures are in there? That's what we're going to talk about. So again, to orient you, you're doing a transverse section of your skull, pulling off the skull cap and then peeking inside. So orient yourself here to the frontal bone, which is very easy to identify. Then we've got two structures, crista galli and the cribriform plate. Now you might be like, oh my gosh, that's like a foreign language to me, because essentially it is. Crista galli means, or translates in Latin, to the crest of the rooster. And that's exactly what it looks like. It's sort of this triangular ridge that projects up into the cribriform plate and then comes down to the roof of the nasal cavity. And then the function for this crista galli is that it attaches to something called the falx cerebri, which is the part of the dura mater, that lining of the brain, that separates the left and right hemispheres. So it sort of attaches to that. Okay, moving on to the cribriform plate. That one's a little different. It looks different too. It's spongy bone and it's got these two canals. So these grooves are on either side of the crista galli, right? And they house the olfactory nerve bulbs. They lay there. And then it's got this sort of, sieve type perforated appearance because the nerve fibers then project through it, right? So that's why it's got these little tiny holes that you would see in the cribriform plate. So again, on its either side of the crista galli. Now let's look at the sphenoid bone, and there's two structures here. We've got the lesser wing and the hypopophyseal fossa. Both of these together make something called the sella turcica, and that is like it's translated to Turkish saddle. So it's the saddle-like appearance, and this houses the pituitary gland, including the stalks of the pituitary gland. Next, we've got foramen lacerum, and I'm going to discuss all the foramen in the next slide, so I'm not going to talk about it anymore here. And then we've got the temporal lobe, which is fairly easy to identify, but there is a petrous region of the temporal lobe that bone that you need to think about, and that actually houses the inner ear. So very important that you know that aspect too. Then we've got the jugular foramen. Again, we'll discuss it in a bit. Parietal bone, occipital bone, foramen magnum, which you know, and the hypoglossal canal. Now this canal, the name should clue you, glossal means tongue, so it's going to house cranial nerve 12. And then we've got the internal acoustic meatus. Now this one has a lot of drama going on there because obviously it connects to your inner ear, right? So this has, it's got, let's see, basically connects the inner ear to the posterior cranial fossa, and it has the facial vestibular nerves that go through it. It has the labyrinth artery, and it also has vestibular ganglion. So it's a lot going on there in this little canal, or not canal, meatus. Okay, then we've got some foramen, and these are a bit tricky to identify, and so I do have a bit of a mnemonic for you in the next slide. But we've got foramen spinosum, foramen ovale, and then foramen rotundum. Okay. Then we've got the superior orbital fissure. Now this is again a triangular shaped opening that you can't see very well here, but basically it connects the orbit, your eye socket, to the middle of the cranial fossa. All right, there you have it. A quick mnemonic for you here. It's fit, energetic, seniors, train often. Starting from the anterior to the posterior, you can see that each letter of the word corresponds to the bone. So we've got fit is frontal bone, energetic is going to be for the ethmoid bone, and then seniors is your sphenoid bone, train is temporal, and then often is occipital. So just a quick little mnemonic for you. Let's talk foramina. I did promise that we would sort of dive in a little bit better into foramina because foramen basically means holes in Latin, and there are tons of holes in the skeleton, right, and specifically in the skull, and so trying to sort of get them organized and sorted in your head can be a bit tricky. So here we have a mnemonic. Now the mnemonic is actually for arteries, veins, and nerves that are in the sort of foramina and passageways in the skull. So not every structure that is in this mnemonic is actually a foramen in the sheer sense of it, but it really helps us identify the foramen, and it also helps us identify the location of specific cranial nerves that go through the skull. So let's take a peek. We've got the mnemonic: creepy old round oval spiders lie around jugs, help me. Okay, so creepy is going to be for cribriform plate, and you know that cranial nerve number 1, which is the olfactory, goes through there or lays there, and you know it has fibers that sort of project through. Okay, and then you've got the optical canal. Makes sense. The optic nerve, so cranial nerve number 2, is going to go through there. Okay, then we've got the foramen rotundum. That is for round. So creepy old round is going to be for rotundum. Now this is where we have cranial nerve number 5. Okay, then we've got oval for ovale, cranial nerve number 5. There's a branch that goes through there too, and that is that. Then we've got the foramen spinosum, which is going to be the word for spiders, right? And this one is a little different. It doesn't have a nerve, but what it has is the mid-meningeal artery that goes through there. Then we've got one that's the foramen lacerum, right? And that's for lie, spiders lie. So the lacerum actually has the internal carotid artery that goes through there. And the way you can remember is that you don't want to lacerate your carotid artery, of course. And then we've got the next word, which is around, and that is for acoustic meatus. Now, the acoustic meatus is going to be in the petrous part of the temporal bone, and the cranial nerves 7 and 8 will actually go through there. All right, keep going here. We've got jugs, which is for jugular foramen. Now this one has cranial nerves 9, 10, and 11 that go through it. And then the hypoglossal canal, so it's not a foramen, but it's a canal. And yeah, this one, naturally, I mean, you can figure it out, it's going to be the hypoglossal nerve that goes through there, which is nerve 12. And then, of course, we've got the foramen magnum. That's going to be for me, right? So hypoglossal was help, and then me is for magnum. So that sort of tells you all the sort of structures that have arteries and nerves and veins that go through it. Oh, although there is another one, which is the superior orbital fissure right here that you see, that is not part of the mnemonic, but this actually also houses a lot of things. Now it's not quite a foramen because it's more like a slit, I guess. I don't know. It's not quite classified as a foramen, and basically this is right under the lesser wing of the sphenoid bone, and it has several nerves that go through it. The 3, 4, 6, and 5 go through there. So those are the missing nerves. You're probably like, where are those? So that's where that is, but it's not quite part of the mnemonic, unfortunately, right? So there you have it. This is a superior view of the skull base. So to orient you, here is Simon the skull's face, and we are looking at things superiorly from the top. Okay, so starting off, we've got the frontal bone, the ethmoid bone, which has the crista galli and the cribriform plates on either side. Then we've got the sphenoid bone, as you can see, and that has the lesser wing, a greater wing, and it also has the hypopophyseal fossa. The lesser wing and the hypopophyseal fossa together make sella turcica, where the pituitary gland rests. Okay, then we've got the temporal bones and the parietal on the side, which you can't see, and the occipital in the back. All right, so now let's look at some of these openings. The very first opening that you're going to see is the optical canal right here. And I think you should be able to see it, right? Like that. So you can see where it sort of comes out. Now, the best way to do this, again, is to use wiki sticks or pipe cleaners to try to get a more 3D perspective on the canals and what sort of goes where. All right, so that is your optical canal. The next thing you want to look at is this is the lesser wing of the sphenoid bone, and under here, it's a bit tricky to see, but under there you've got something called the superior orbital fissure. Now it's not a foramina, it's not a hole, it's more like a crack, but it's got several structures that go through there. Then we've got this. This is the foramen rotundum. Now, the foramen rotundum was not drilled out in my skull model, so I just sort of drew it, but that's where that would be, and it would be a round sort of looking foramen, hence the name rotundum. Then we've got an oval looking one, which is foramen ovale, and then one that looks like a little dot, that's going to be your foramen spinosum. So, and on this side you can see here is rotundum, here is ovale, and then this is a spinosum. Okay, now next to it, or adjacent specifically to the ovale, is this, and this is your, let me look at it on this side, this purple structure here, that is going to be your lacerum, foramen lacerum, and this actually houses the carotid artery. So I think about it this way, like you don't want to lacerate your carotid, right? So that's how I remember foramen lacerum has that structure going through it. Okay, so moving on, let's look over here. This is actually your it's called the petrous region of the temporal bone, and this actually a petrous ridge too. And then under there is this sort of opening, and that's going to be your internal acoustic meatus, right? That's what that is. Okay, then you've got this fairly large foramina, and this is going to be your second largest, because obviously foramen magnum is the largest, but this is your second largest, and that's going to be your jugular foramen, right? It's going to have lots of structures that go through there. Okay, then of course you know the foramen magnum, but then on either side of the foramen magnum there's this green, you see this green structure that goes through there. That is going to be your hypoglossal canal, and of course you can guess what goes through there, the hypoglossal nerve, obviously, right? So there you have it. That's essentially all the foramina when we're looking at it from a superior view of the skull base. Now let's take a look at the base of the skull foramina contents, but we're going to draw them because this is a great kinesthetic way of really mastering the foramina. So here we have the base of the skull, and you can draw it out, or you can just take a printout of the base of the skull, put it in a sheet protector, and then follow along. So the first thing we want to do is sort of orient ourselves. Frontal bone, temporal, sphenoid, parietal, occipital. Here's the ethmoid bone, and that's your cristogali and your cribriform plates on either side. And then, of course, we've got the big hole, which is your foramen magnum. So starting at the top, the very first is going to be your optical canal, and that's fairly easy as far as a landmark because you'll see those structures fairly easily in that area. Then we want to go to the superior orbital fissure, which is right under the lesser wing of the sphenoid bone, right? That's going to be a little different in structure because remember, it's a fissure. It's not quite a hole. It's more like a crack, right? And then after that, what comes next? We've got the rotundum, which is going to be right here, and it will be round. After the rotundum, we know that we've got ovale, which will have this oval appearance. So foramen ovale. And then after that, we want to find the other one, which is the lacerum. And that's more like a laceration. It's like a teardrop almost. And that's going to be right next to it, foramen lacerum. Okay, but we forgot one, didn't we? The spinosum. So that's just going to be a little dot right there. Okay, to review, optical canal, superior orbital fissure, rotundum, ovale, spinosum, and lacerum, right? Okay, then we've got the next one, which is going to be your external acoustic meatus, and that's actually going to be right here. Oh, let me see if I could draw it. It's like a little kidney bean. That's going to be your internal acoustic meatus, and then right sort of under that, at the border here of the occipital and temporal, is the big one, right? This is your jugular foramen. Now, don't pay attention to the sizing, because it's a little technical to get the sizing accurate from this perspective, but essentially that's what that is, right? So we've got your internal acoustic meatus, your jugular foramen, and now, of course, you know this one, the foramen magnum, but you remember there's one that's either side of the foramen magnum. Do you remember what that is? So we're going to draw that right there and right there. That's going to be your hypoglossal canal, right? And there you have it. Those are somewhat of the foramina that you might see. And again, it's super helpful to draw it out. So I definitely encourage that. Okay, now we're finally ready for our mind map because there was a lot to cover, right? The skull obviously is one of the most complex aspects of our body and the anatomical features. There's so many. That's why this mind map is loaded. It's loaded with mnemonics and lots of key features that you need to know. So use this as a study guide. Print it out and jot down things that you need because you have all the mnemonics in one place to really memorize some of the aspects. And don't forget, if you can get a model of a skull, get it from the library and get some pipe cleaners and use those to really figure out different foraminas because that's really going to help you from a hands-on kinesthetic learning perspective. Again, comment below if you found this helpful or if there's anything else you'd like me to add to this topic, and I will see you next week. Bye-bye now.